My name's Kelly. I'm a BSN student at Columbus State University, and today we're going to be talking about delivering culturally competent care. What is culturally competent care? It is the ability for an individual to understand and respect values, beliefs, attitudes, and morals that differ across cultures, and to consider and respond appropriately to these differences in planning, implementing, and evaluating health education, prevention promotion, and your interventions. An individual's beliefs and behaviors about health and their well-being are molded by multiple factors such as race, nationality, language, gender, and or ethnicity. So why is cultural competence important? Cultural competence reduces the risk of health disparities and improves the quality service of health care that is responsive to the needs of the patient as well as respectful of their beliefs. How can this impact patient care? Cultural competence allows the provider to make an accurate diagnosis based on a complete assessment. It reduces the delays in seeking treatment. It allows the provider to devise treatment plans that are respectful of the patient's beliefs, and it increases adherence or compliance to the recommended treatment by the provider. How does culture affect healthcare? Their culture can influence their perception of their illness, their beliefs of the cause of their disease that they have. It affects the manner in which, or the timing of how they seek medical attention, and also how they behave toward the healthcare provider or healthcare workers in general. So, delivering culturally competent care, the nurse needs to understand his or her own views and also those of the patient. It's important you need to avoid stereotyping, listen to the patient verbally even if they speak like broken English, see if you can, communicate verbally and both non-verbally, because you can learn a lot if you just watch the patient and take nonverbal cues. And also utilize interpreters if they are accessible. So the Hispanic population, in 2013, the United States Census Bureau estimated that the population of the Hispanics in Toombs County, where we live, is 11.4%, and this is a 3% increase in the past decade. According to the U.S. Census Bureau, Georgia is one of 16 states with at least 500,000 Hispanic residents and was ranked among the 10 states with the largest Hispanic populations. Language barriers can compromise the quality of care, leading to medical errors and medication misuse because of poor communication. When you're using an interpreter, try not to use family members. The patient may be too embarrassed to discuss anything that would be important for their medical treatment, and they may not be 100% honest if you ask them something if they're around family members. Anticipate and recognize misunderstandings that arise from differing cultural assumptions and expectations of providers and patients. Their diet is rich in complex carbohydrates, and this is mostly provided by the corn and corn products. Typically, the Hispanic population eats tortillas at almost every meal. This includes beans, rice, and breads. Because of their extensive use of frying as a cooking method, the diet is also high in fat. Protein in their diet comes in the form of beans, eggs, fish, and a variety of meats, mostly including pork and poultry. So their barriers to health care include language, lack of health insurance, poverty, transportation, and their immigration status, because they may not seek medical attention due to fear of deportation. Their cultural differences, just to be aware of, they rely more on home remedies and over-the-counter medications. They rely on advice from their family members. less compliant with preventative measures. They typically do not seek health care until the problem is severe or it persists despite all their recent efforts. So Hispanics are less likely to seek or receive health care services, which may contribute to their poor health status and higher rates of morbidity and mortality. So it's just important to get an overall understanding of their culture, and this will help us provide better services to our Hispanic population. Thank you for participating.